Welcome to Section 2 of Psychiatry. In this section, we'll be discussing childhood behavior disorders and anxiety disorders. Let's get started. Here's the psychiatry overview figure, and we will be focusing on many of the childhood disorders which can be found up here. For example, selective mutism, separation anxiety disorder, oppositional defiant disorder, and conduct disorder. In this video, we'll discuss several different childhood and developmental disorders that deal with behavior and emotional dysregulation. We will come back to this table again and again throughout this video, so you'll be able to see the big picture. With this in mind, let's start with conduct disorder. This is a childhood disorder of impulse control. Conduct disorder is characterized by a pattern of behavior that violates the basic human rights of others and breaks societal norms. For example, we're thinking of theft, aggression, and cruel acts. And children to be diagnosed with conduct disorder must display this behavior for longer than 6 months. If a patient is over the age of 18, it's considered antisocial personality disorder. Conduct disorder can often be confused with oppositional defiant disorder, but we'll help you understand why these are different and how you can prevent getting tripped up on a test. But the main thing to remember is that people with conduct disorder really do criminal acts, while people with oppositional defiant disorder really aren't committing crimes. So if you look at the far right column for the memory hook, we can see that conduct disorder, CD, can help you remember criminal deeds. So people with conduct disorder are basically little criminals. And the best bet you have at treating conduct disorder is cognitive behavioral therapy. Let's discuss what this is on a new slide. Here's an overview of cognitive behavioral therapy, also known as CBT. We will reference CBT in many of the upcoming slides and future lectures, so you can come back to this slide to get an overview or a review of how this works. The overall purpose is to help patients identify or correct distorted or maladaptive beliefs. And as I alluded to, it's used to treat many different psychiatric conditions. For example, depression, anxiety, PTSD, eating disorders, and OCD. So CBT will come up again and again as you discuss these different pathologies. Now there's various techniques that can be used in cognitive behavioral therapy. For example, you educate the patient, you can teach the patient relaxation exercises, you can perform coping skills training, as well as stress management and assertiveness training. So the exact approach you take during CBT and which techniques that you end up using really depends on the nature of the disorder. But again, the overall premise is to help the patient identify and correct distorted and maladaptive beliefs. Now that we've discussed CBT, let's talk about the next pathology, oppositional defiant disorder. Now this is less severe than conduct disorder in that behaviors do not involve violating the basic rights of others. So this pathology is not characterized by criminal actions. Basically with this disorder, there's over 6 months of someone who's angry, has an irritable mood, argumentative or defiant behavior to authority figures, and they're often vindictive. But they're not criminal. So when you think of oppositional defiant disorder, ODD, think of the memory hook, openly defiant and vindictive, ODD. That's very different than being a criminal, and the criminal deeds associated with conduct disorder. For example, a 12-year-old girl who hates school says her teachers are idiots, purposely annoys her classmates, maybe she skips class, blames her actions on others, and openly defies rules or requests given to her by her parents and teachers, or just defy requests that her parents or teachers might give her, and she has that vindictive, oppositional, defiant behavior. Kind of just like a punk kid. Not a criminal, just a chump. And just like with conduct disorder, the main treatment for oppositional defiant disorder is CBT. Now let's talk about disruptive mood dysregulation disorder. This disorder involves a pattern of severe temper outbursts at least 3 times per week. And these tantrums may take on a verbal form or a physical form. And without fail, they're usually disproportionate for the situation. And they're also incongruent with the developmental stage. For example, a 9-year-old in 2nd grade who doesn't get his way should not be slamming his fists on the table, shouting, hitting the teacher, turning red, or shaking due to rage on a regular basis. That would be very strange, or rather, very indicative of disruptive mood dysregulation disorder. So children with this disorder will have angry or irritable daily moods, and as we mentioned, this really should happen 3 or more times a week, and it must occur before the age of 10. And also, these behaviors should not be present during episodes of depression. In other words, rule out depression or other disorders such as autism, PTSD, or separation anxiety. Typically, the treatment includes antipsychotics or even stimulants, such as Adderall. And the memory hook for this disorder is DMDD, which kind of sounds like TNT, if you say it really fast. DMDD, TNT. And TNT is explosive, as in explosive tantrums. Now, the next two disorders are really focused on anxiety, selective mutism and separation anxiety disorder. Selective mutism is an anxiety disorder with an onset before 5 years old, and for a diagnosis, it must be going on for over a month. Now, with selective mutism, you need to recognize that these children have normal language and speech abilities. They're just selectively choosing to not use those abilities. So they're only silent in certain situations. And you may think that because they have normal language and speech abilities that it's an okay disorder to let persist, but it's not, because selective mutism really can impair functioning. For example, it can hurt their development in school or social settings because of that silence. They just miss out on so much development. Treatment for selective mutism involves CBT, as well as family and play therapy, and the use of anxiety-reducing medications such as SSRIs. The goal of all these treatments is to help reduce anxiety. And the memory hook for this condition is mute for a month. So mute, selective mutism, and a month to help you remember that they need to display this behavior for greater than a month. Now let's talk about the last disorder, separation anxiety disorder. This is an anxiety disorder characterized by excessive worry surrounding an attachment figure. For example, being separated from that figure or worrying about harm coming to that figure. This is a fairly common disorder, and to really diagnose it, you need to see these symptoms for greater than a month. So just like the other childhood anxiety disorder, selective mutism, it's also a month. So you can remember that these childhood anxiety disorders need to be present for longer than a month to be diagnosed. And it's normal for infants and toddlers up to the ages of 3 to 4 to cry and cling to their caretaker, especially when they're being separated. But separation anxiety disorder involves an extreme version of that type of anxiety. For example, if a 4th grader was not able to focus in school or struggled to make friends because he's constantly worried about being away from his mom due to fear that she might get hurt or that he might not be able to get back to her, and would not be classified as normal anxiety, we'd call this separation anxiety disorder. Some other ways to witness the extreme nature of separation anxiety disorder over the normal anxiety that little kids can get are some of the other symptoms that they can have. For example, they can have nightmares, they can have nausea or headache, and these physical symptoms occur in anticipation of that separation. For example, they're just panicking all night because they don't want to go to school tomorrow and leave their mom. And interestingly, because of this anxiety, these children may have factitious complaints in order to avoid that separation. For example, they might just develop symptoms or make up symptoms. Now, when it comes to treatment, the goal is very similar to the treatment for selective mutism. You're really trying to decrease anxiety. So you can do this through CBT or family and play therapy. And the memory hook for this disorder is sad to leave. So SAD, separation anxiety disorder. So they're sad to leave. They don't want to leave their mom or dad. Now that we've covered all these disorders, let's do a quick question to apply what you've learned. An 8-year-old boy is brought to the clinic because his mother is worried about his behavior. The mother describes an incident in which the patient lost a game of chess and began yelling and screaming at the friend he was playing with. She states her son does this sort of thing often, but is really kind and happy most of the time. Which of the following disorders is most likely present in this boy? A. Conduct disorder. B. Oppositional defiant disorder. C. Disruptive mood dysregulation disorder. Or D. Antisocial personality disorder. Now this boy most likely has disruptive mood dysregulation disorder, which is choice C. Disruptive mood dysregulation disorder is often confused with oppositional defiant disorder. However, DMDD, as we've described before with this memory hook, is more like episodic explosions, much like TNT. So think explosive tantrums when you think of this disorder. Whereas when we look at the memory hook for oppositional defiant disorder, ODD, just think of an overall attitude of defiance, or openly defiant and vindictive. So oppositional defiant disorder is incorrect. And conduct disorder is incorrect because this involves the violation of the rights of others. So when you think of this disorder, remember the memory hook, CD for criminal deeds. And lastly, antisocial personality disorder can be diagnosed only after age 18. So answer choice A, B, and D are all incorrect. This patient most likely has disruptive mood dysregulation disorder, choice C. And that concludes this section.